Good afternoon to all our guests and delegates. The National Occupational Safety and Health Coordinating Council of the Philippines welcomes you to this webinar entitled Control and Management of COVID-19 in the Workplace. This event aims to discuss the salient features on the joint DTI and the Department of Labor and Employment interim and supplemental guidelines on workplace prevention and control of COVID-19. We are very honored this afternoon to have Dr. Tesco Cueco, the Assistant Secretary and concurrent Bureau of Working Condition Director of the Department of Labor and Employment, as our guest resource speaker for this webinar. Dr. Tess, good afternoon.
Good afternoon, Neil, and to all your participants in this webinar. Good afternoon po sa inyong lahat. Thank you for inviting the DOLE again to share in our issuances, especially on the joint guidelines as well as the clarificatory advisories.
Hey, Doc, you may, do you have your presentation, Doc?
We can start now. Okay, thank you. Thank you, Neil. I mean, really, my apologies because you really wanted this at a later time, but there may conflict lang sa schedule. And you do have a good number, so let me start. Can I share my screen, please?
Yes, Doc. Yes.
Thank you. Dali ah. Do you see it?
Yes, Doc.
Yung supplemental guidelines?
Yes, Doc. Ano na lang,
okay.
For projector screen na lang siya, Doc.
Okay, thank you. So again, you know, I hope we're now all looking at the supplemental guidelines on workplace prevention and control of COVID. We're actually 1 year into COVID. In December, this was when it was discovered in Wuhan. And we are now 10 months as it has really impacted in the Philippines as at our since March, where we felt, you know, the increasing cases. So this is already actually the second guidelines issued by the DOLE and DTI, with the first one issued in April, which was the interim guidelines. So comparing the first to the second, we, in the first issuance and the interim that was issued in April, we really looked at four major items or areas in addressing COVID. And this is still part, of course, of the supplemental guidelines of this joint memo circular. However, we added on more details. And, you know, I think we issued this in August. So I think most of you are really familiar with all of this. But the additional here is afterwards, I will present to you the third clarificatory advisory. This one already carries the first two. After this was issued, we had a first clarificatory on the testing, then the second on shuttle, and the third again on shuttle, because this has been a main issue among our workplaces, and how, you know, we can help, of course, our employers as well as employees in the issue of shuttle services on contact tracing. So having said that, then going back to our joint memo circular, aside from the first issuance, which was, all of these are anchored on the DOH minimum public health standards, as well as their other issuances. We, of course, when we issued this, the second issuance or the supplemental guidelines, we had to take into consideration the management of symptomatic individuals if they're ever discovered at the workplace. What now is safety and health in August, as we have been seeing increasing cases, and how you should be handling and preventing. What are the more important preventive measures now as we look at all workplaces and establishments? What is now the notification reporting? Because even the DOH has already issued its IRR for the reporting law on diseases, and then the disinfection and closure of workplaces and buildings. This has moved. I mean, we also had to issue a clarificatory here following the issuance as we gave it in the supplemental guidelines because of many items or questions that you have raised, and because this is a workplace and workers are going to be affected, the leave of absences and entitlements are now part of the supplemental guidelines. Now, the on increasing physical and mental resilience, this was already part, like I said, on the first interim. Here we just again reiterated the importance of physical and mental health. And here we added on the numbers that you can call, because I think in August we were already having cases of or we were hearing reports that many workers, not only workers actually, uh, many of those or many of us actually, whether we had COVID or not, there were mental health concerns that already had to be addressed. And that was why the numbers here reflect or can be used to reach out to the experts on mental health. And we also added that you can get more of these numbers or more of the experts who can help you here in the BWC website, www.bwc.dole.gov.ph. And we again stress that promoting good work-life balance is very important, especially because of the stress at these times. Now, um, on reducing transmission of COVID, again, the minimum public health standards, the masks, that's never been changed. It is still allowed. It should be used. There is a mandatoriness here. And in all, actually, as soon as you leave the house, masks should be worn. Now, the two types of masks, disposable or the better type of mask and the cloth mask may still be used. But then, of course, as if you're going to be using the cloth masks, then you should be cleaned regular. It should be cleaned daily. We now added the use of face shields as an added protection. It's not part of the minimum public health standard, but it's an additional protection for both the workers and the clients whom they're interacting with. If you're both using face shields and masks, that's a very good protection already, because you're limiting secretions really among yourselves. And because we have asymptomatic carriers, and we know that as a fact now, we are whoever you talk to, and if you are, even if you may or the person you talk to may be a COVID case, then there is that protection from the mask and the face shield, so that you are not transmitting it to others, nor will they transmit it to you. To increase, of course, the protection will be physical distancing. We're still adopting the 1 meter physical distance. It has not changed. It is still part, especially these are in all workplaces. This has changed a little because of the shuttle services. But aside from the shuttle, and it is mandatory that physical distancing should be observed in all workplaces. Together with frequent disinfection, uh, we can never overemphasize the need to eliminate those germs, those microbes, including COVID, from our hands if we touch any surface where there might be secretions, or where any germ or COVID may be, and you touch it, then it goes to your face. That is the transmission that we want stopped. And once you frequently wash your hands with soap and water and disinfect with any alcohol-based disinfectant, you will be eliminating the the germ, the microbe, and you will also be stopping the risk of transmission to yourselves. We would also like that all of this is a constant reminder to everyone. What we're seeing now is because we are seeing that we are grateful that our cases of COVID is being maintained, that it's not saying it's low, but at least we're now at the 1,000 level for several weeks. For I think a few days past, it went above 2,000, but most of the time now we're in the thousands, and even now at the lower 1,000 level. And it sometimes it might lead to complacency, and that is why here is where we're reaching out to tell people, let us not, and we should never be complacent, because COVID is existing. it is there, and we should always be protecting ourselves. And the best way to remind that is to have this display of signages or visual cues. We should have that constant reminder, whether it's posted in our workplaces, whether you always see it in the advertisements, in our online webinars, in advertisements in the cell phone, social media. These are very important visual cues and to remind us how to protect ourselves, especially in these times of COVID. And we're also telling companies that they should have these webinars, these virtual lectures and trainings on COVID-19 prevention and control as a constant, not just a reminder, but to also update. So now, if we ask our workers, or we might are asking ourselves, what is the latest update on vaccines? Because we are already seeing that vaccines, they're present. They're now. I think Pfizer had had their vaccine um, uh, pass the UK regulatory body, and now where are we? So all of these updates are very important, and we should also be giving this to our workers so that they will not get updates from Facebook or fake news. And that is why we are telling companies, please bring up the latest information, the latest update. You can have that in the WHO, the DOH website, and of course other government websites, because it's our responsibility to put in updated factual items on COVID. Ventilation is a very important issue, whether it's in your own establishment, in the workplace, in the company setup, or in shuttles. Because ventilation, as we all know, is also one of the means or an engineering control to bring in fresh air, uncontaminated air, and to bring out contaminated air. And that is why we leave it to the safety engineers. You know, this has been a perennial question. We always say open windows, open doors. Then companies would say, but we cannot open our windows, nor can we open our doors, because there are precautions in operations. If that is the case, we leave it up to you to put in how best to to place the air exchange. You can have uh, air exchange mechanisms. Your safety engineer should know that. Or the HEPA filters. These are just examples of how to provide or adequate ventilation and to filter out harmful materials from air, and of course not affecting our workers. Then of course inside shuttle services, that it should also that there should be adequate ventilation so that it is not kept, a shuttle service is like an enclosed space, like a room, because there, it's enclosed, the windows. But what we're saying also is that if you can open the windows, then that's best. That airflow is really the best way of getting rid of contaminated air and bringing in fresh air. Mass gatherings should still be avoided. In fact, because of the Christmas season, this has been an issue, and this has been being raised, especially as our Christmas tradition wants us to be together with family, with reunions. At this point, the DOH keeps on reminding us, and even our LGUs, it may be a little bit different now, but it is only temporary, that we are going to have this, the different Christmas. We cannot be together because that will be a mass gathering. And when there will be more people, that you may have an asymptomatic case present will also increase. And that would mean you might be exposing those who are in that mass gathering to a positive case of COVID. And then what is more difficult there is if it is passed on to a vulnerable population, or the most at risk, those who are most at risk. So for office settings, we're still saying please limit. If there should be meetings, limit it to the number of people who should only be present. Look at the room. If you can have 50% capacity, if it is low risk, and now we're on GCQ anyway, so we're really looking at 50%. But if it's high risk, we're just saying limit it to 10% of the seating capacity, and also limit, what are the risk factors that increase transmission, the number of people, the length of time, and of course the absence of protection. So if you use all of these three and then put in where we can put on the levels of protection, we are then lowering the risk. And this is why also for canteens, dining areas, and you will also see smoking areas, we have also adopted the protocols of uh, in canteens, the 1 meter physical distancing among, not in terms of tables, but you might have a table with many chairs, but then have the 1 meter physical distancing plus additional barriers. And then no queuing, because what we want to avoid is that when you queue, even if you say there will be enough distance, people will interact. And when people interact, you forget that you should be protecting yourselves through uh, through physical distancing, and you would get closer, and you again are it's not that we tend to then forget that we still have to have the necessary protection in place, or we still have to follow the necessary health protocols. So in canteens and dining areas, we should all have the necessary protocols. You are the safety officers. You should also know all of this, and that once a person is done with eating, that area should be immediately disinfected. All materials that are used that could be disposed of should be disposed of, or that should be washed after, then it should be washed properly. So these are things that we watch out for, not just in canteens. Let me go back. It should also be done in smoking areas. Limit the number of people in smoking areas. Even if it is done outside, have physical distancing. If please do not let them all gather again, because you will forget, and then that they're because they're all they're all seeing each other. They tend to may come closer to each other, and that's why we're always saying limit the number of people, even in locker rooms, and especially in bathrooms. In bathrooms, especially the common type, of course, where you might have those who will wait for the cubicles, then they just not limit it. Do not allow that. Just make sure that it's if there are only two cubicles, then once they're being used, there should be no queue inside, but then the next one to from outside to go in, because masks will be off when you and then you you are bringing down again, or you're bringing up a risk factor when you start talking to each other and when masks are off. So it is very important that all of these risks are recognized by the Safety and Health Committee. That is why the Safety and Health Committee is now one very important committee that should be developing and implementing the safety and health COVID programs in any workplace, together, of course, with the safety officer. As safety officers, please, there are the times where you see the word safety officer often being used. You talk of the PBA bubble, they talk of the need for a safety officer. You talk of the bubble in for the entertainment industry. You will see the need for a safety officer. It's mandated already that safety officers should be present. And that is why this is where you're really seeing the responsibility of the safety and health, the safety officer, to provide the necessary guidance. You should know really what the protocols are, and you should follow it strictly, because protection of everyone is very important, especially during these times. Reducing infection is also looking at how to detect who can possibly be infected. And here we talk of the health declaration form. We know this in our workplaces, we always have to fill it up, whether physically filled up at the point of entry, or having to fill it up contactless, meaning you already have developed applications for this. That's fine with us too, online, as long as it is done. And it is a daily health declaration form. This is really a reminder that if you are not feeling well, if you have in your health declaration, if there is any symptoms there that you might use or to check, or there's an exposure, there's a portion there that also asks if you're exposed, then it should make you think twice of whether you should be reporting to the office or you submit it and then just report to HR. Because our message here is, if you do not feel well, please do not go to work, so that you will not be possibly infecting others. But then now use teleconsult so that you can reach out to the health personnel and be properly managed. The temperature check is also, of course, part and parcel of that health declaration form. And this is really for our own workplaces where we go to work. But now the contact tracing, you will see this now as part of the third, a clarificatory advisory here. I have filled up a contact tracing form that asks so many things, and it is almost like a workplace health declaration, because even our symptoms was asked. But really, for contact tracing of customers and visitors, what is really essential would be the need for the person's some personal details, because it is a contact tracing form, so that if in case, at the time you were there is a case, and it was discovered a case was present, you will be called to monitor yourselves as well. This is also, of course, to ensure that you know that hopefully, of course, you will not get sick, but then that there will be that need that you should be also monitoring yourselves. The important thing here is that for both the health declaration form and contact tracing forms, it should be properly, the security of all these forms is essential, meaning to say it's confidential. It should not be just be loosely kept anywhere. There should be a person responsible in handling all these forms, and after a month, all these forms should be disposed of. Now, if anybody would feel unwell, then it is really, and we're saying they should not be reporting. This is why we are asking everyone, and DOH has also put in the teleconsult type of service. Just call, there will be someone to assist you in terms of what to watch out for, how well to manage whatever you're feeling, whatever you're feeling. If it is a health, if you should be further assessed, then if your company would have this teleconsult service, that is good. Just use their number, but if not, the DOH number of for their telemedicine teleconsult 1555, that works. Please use this. This is also the same as what I just said, remote management, meaning to say it is now telemedicine, teleconsult, telehealth that we would like people to use, so that there will be no physical presence either in a clinic where there would be more people who may be present and may possibly be infected, but rather from your own home, you can already reach out and be properly managed. Now, if there is a positive COVID case, it is very important that contact tracing is done. And how do we define a close contact? Because you are going to do contact tracing, and what is important is that we can determine who the close contacts of a person who is positive or with a suspected case, who are the close contacts of these individuals. So close contacts are those with exposures 2 days before or within 14 days from the onset of symptoms of a suspect or confirmed or probable case. So, suspect pa siya kasi may symptoms at hindi pa siya nag-test ng positive, pero he already has COVID-like symptoms. Yung confirmed has already been confirmed positive. And probable like suspect is an individual who's also being monitored because there was also exposure to a COVID case. So you are a close contact if you have, if you were in the presence of a suspect, a confirmed or a probable case, and there was face-to-face contact with a confirmed case within 1 meter or 1 meter or less for more than 15 minutes. So like I said, this is why physical distancing, duration of exposure is very important, because this increases the risk for the possibility of an infection. And this is why we are now identifying how to determine who the close contacts are. So with less than a meter, more than 15 minutes, with or without a mask, if there was direct physical contact with a confirmed case, or there is direct care for a patient with a probable or confirmed COVID-19 disease without the use of any PPEs. If any of this scenario is present, you are considered a close contact. And uh, from a confirmed case, to determine close contacts will really be to interview and to assist in the interview if they may forget. That is why we have all of those contact tracing forms, as well as the use of additional mechanisms such as CCTV to identify who a confirmed case has been, whom he has been exposed to, or who he has worked with for the time, the length of time, um, and um, the without the physical distancing requirement. So all of this, the use of the CCTV may be able to assist in identifying these close contacts. Now, it is very important, and this is up to now there were so many issuances of the DOH on on testing and close contacts and quarantine. If you're a close contact of a confirmed case, you really have to finish the 14 days quarantine period. Isolation is for a case because you're isolated so that you do not infect. Quarantine is when you are asked to monitor yourself away, of course, from the public, and it has to be done for 14 days. Even if you test negative when you say, let me then just be tested. Even if you're tested and it tests negative, if you're a close contact, your quarantine period should still be 14 days. They say this is the way to do it, because symptoms can still manifest even after 12 days. But at 14 days, if there's no symptoms that would manifest and you're a close contact, then there is no more there is no more possibility that you will be infected from COVID. Now, during the 14-day quarantine, the close contacts should be required to regularly report. There's if there would be symptoms, even some would even ask for their temperature checks. But this is done so that to assure yourself, to assure your family, to assure your employers and the barangay, because you would need that clearance that you have there were no symptoms at all during the period of quarantine. COVID-19 testing will still always be dependent on the DOH issuances. The DOH released its expanded testing strategy, and the latest is they also had additional testing issuances, because antigen test can now be done depending on the situation, and that is in DOH DO 429. If I'm not mistaken, 429, but I know it's 429. And please, you have to be guided by this. 258 gives you who can be tested, and if you use that, you can be reimbursed by PhilHealth. And this is the portion of the slides on that expanded testing strategy and who can be tested. So in that 258 and 258-A, it says that all employees in the hospitality and tourism sectors of El Nido, Boracay, you see this, may be tested. It's not really mandatory, but if you want them to be tested, they may be tested once every 4 weeks. I will now go into this definition first, because in the next few slides, you will see this as a requirement for the testing of certain group of workers, but that they should be in this category, a special concern area. What is a special concern area? These are those areas with high prevalence of COVID cases, or it may be, the whole area may be MGCQ, but suddenly, and here is what we see, like we see in, I think, Iloilo is MGCQ, or Benguet is MGCQ, but there are areas there where there was clustering. And in those areas, it was these are now called special concern areas, and people where those clusters are found to have to be positive and are close contacts, then they may be tested. So these are very important definitions that you should also look at, because it is these are categories that are requirements in the next slides that you will see. And another definition of a special concern area would be those identified by the National Task Force. So COVID-19 testing can be given to all employees of manufacturing companies and public service providers, meaning to say they are manufacturing, but they are exposed to the public in special concern areas. And that's why I already defined special concern areas. And these employees may then be tested once every quarter. So if you are in, for example, um, an EPSA in Cavite, and does it mean to say that your thousands of workers can now be tested even if it's once every quarter? What it is saying is they should also be public service providers, meaning to say there is interaction with the public among those workers. Otherwise, like I said, this can be reimbursed to PhilHealth. Magkakaubusan na po din talaga ng pera na PhilHealth if you're going to require that all. You can have it done actually, but then for those who are not anymore who will not be covered by the definition provided here, then you will have to pay for it. The employers will have to pay for it. Other workers who may be tested are defined as the frontline and economic priority workers, meaning they are doing work in high priority sectors. And these are now the sectors I will be showing to you the next few slides. For both public and private sector, they have high interaction and exposure to the public. And that is also going back to what I just mentioned in the export processing zone. And they live or work in a special concern area, and they may now be tested once every quarter. So who are these frontline and economic priority workers? They are those in the transport and logistics. So you can see the list from drivers, conductors, pilots, flight attendants, flight engineers, rail operators, mechanics, servicemen, delivery staff, water transport workers. All of these workers are now considered frontline economic priority workers, and then they may be tested once every quarter, reimbursed by PhilHealth. Other frontline priority workers would be those from food retail, and you see the list of those who are workers under this category. In education, financial services, non-food retail, market vendors. For services, and here you have the list including hairdressers, manicurists, massage therapists, embalmers, parking lot attendants, security guard, messengers, the clergy, construction workers, the carpenters, stonemasons, electricians, painters, the foremen, supervisors, civil engineers, crane and tower operators, elevator installers. You also have for water supply, sewage, and management, the public sector, as well as mass media. All of these categories are considered as the frontline and priority sector, where the workers that you see listed may be tested once every quarter, but as long as they are in a special concern area, these workers have interaction with the public, they can be tested once every quarter with reimbursements to PhilHealth. Now, testing of symptomatic and close contacts, uh, the DOH really, even in many of our consultations, they discourage indiscriminatory mass testing. But if you want it done, that's so, they have no problem. It's really up to the companies to do that, but it should be at the cost of the employers, never to the workers. DOLE already issued Labor Advisory 18 that all costs of COVID, including testing, will be chargeable to the employers. Now, when is testing then mandatory? if you have symptoms of COVID. Then if you are a close contact with symptoms, of course, then that becomes mandatory as well. So that is these are the only times that we are looking at for workplaces when testing becomes mandatory. It's not mandatory for any worker, a symptomatic worker, the company says, okay, we're open now. That was why we had an issue with LGUs when from ECQ, we were opening up to MGCQ, and establishments were opening. It was not required that testing be part of the return to work. But of course, if you have symptoms or there was exposure, we would recommend that testing may be done. But please always understand that testing is not a blank check to say, once tested negative, you will always be negative. In fact, testing is only good for that point in time. Meaning to say, if you're tested now, if you get your results 2 days after, ganito pa nga yan you're tested now, then uh, the night after your test, you went out, you went to a bar, you met with friends, you waited for the test, the following day, wala pang result, you waited for the test, 2 days after, it was negative, then you had symptoms on after the test, you know, even if you tested negative during that day, but because you went out that night, wala nang saysay po yung test. And that is why it is so important that we realize the constraints of testing. And the testing that is really the gold standard up to now is RT-PCR. Antigen may be done, but it is only done in specific situations. And please understand, if you're going to do the antigen testing, these are those that are recommended or that have been approved by the FDA, because not all antigen tests that are existing in the Philippines are approved by the FDA, and that the specificity and the sensitivity range will also be as required by the DOH or the FDA, which I think is like 95% in terms of its sensitivity, and for its specificity, 80%. So these are requirements for the antigen test. Now, it can be done like where RT-PCR tests, there is a lack or there is no RT-PCR laboratory that can do a testing, and it is usually dito after the typhoons, the evacuation centers, you would see that they resorted to antigen testing because for many of the areas in the north, there was a dearth or there was a lack of RT-PCR test that could be done, and they needed the test right away to remove evacuees who may be positive from infecting others in the evacuation area. So again, in the latest issuance of the DOH, you would see when antigen testing may be necessary, but not, the gold standard is still RT-PCR. So on the symptomatic, okay, if there's any travel exposure to COVID-19, a 14-day quarantine, that's really part, especially like I mentioned for close contacts, the need for a 14-day quarantine. Now, if you're symptomatic, uh, the the rule is, and it's you have COVID like symptoms, please have yourself tested so that you can also be properly managed. But then go on isolation also already. And for the close contacts, then they should be quarantined for 14 days. Now, workers previously symptomatic shall undergo the 14-day quarantine, and if no new symptoms manifest, they can resume work without need for testing. Actually, there's also something I would like to clarify you with all of you here, because in the DOH memo of 429, they also mentioned that if you are a confirmed positive case, actually at 10 days you are no longer infectious. So you can, if you are in a if you are in a temporary treatment monitoring facility, you may be allowed to go home to continue either the rest or until you're cleared by the barangay or the health worker that you can go back to work. But if you have symptoms or you were in a hospital, that 10 days becomes 21 days. But I really need, please go back to the DOH issuances, because what we use and what we will always refer to here would be the latest DOH issuance. Any on asymptomatics, like I mentioned, we are not really there. We're not requiring any test, especially no symptoms, no exposure, no nothing. There should really be no need for any test. Now, RT-PCR, the rapid antibody test is not anymore recommended at all. Reporting of close contact and cases and close contacts should be done um, if, for establishments where your establishments are located. Please report to the LGU. Now, for the workers who test positive, they should be reported to the barangay of the residence of the worker. If the worker is in a boarding house and that is where he usually stays, then it is to the barangay of the boarding house of that worker. So we were in the beginning, we thought all residences, even to the where his usual place of residence is aside from the boarding house. But if we were clarified that if the boarding house is his usual place of residence now, especially after he became a case, then that you can stop the reporting as long as you report to the barangay of the boarding house where he has resided in at this most recent residence. On leaves of absences for all workers, it is still going to be the leaves required by the labor code and those issued by the DOLE. So it depends on what your company leaves are, the sick leave, the vacation leave, if it's the service incentive leaves, these are all going to be, this should be complied with. Now, for COVID cases, there are hospitalization benefits from PhilHealth. It has already arranged. In fact, it has also changed. Packages have also increased, including a 750,000 package for those hospitalized with, I think, moderate and severe cases. But just to tell you, I think the bills of those really who are very severe can run up to the millions. Social security benefits have also for COVID has also been provided already by the SSS and the EC if it is work related. For EC, you have to prove, of course, that you got COVID from a coworker or from an exposure in the workplace. Now, for those who would go on quarantine and close contacts, because you are not, or if you did not have yourself tested, you would not know if you're COVID positive, or you had yourself tested and you are not COVID positive, but you are required to go on quarantine. Wala hong quarantine leave ang labor code. And we could not also, the DOLE cannot ask the employers to issue this kind of a leave because these are really now there are constraints in the labor code up to when we can only require employers to provide the necessary leaves. But what we're telling employers is that through their generosity, they might wish to really supplement workers who have to go on quarantine with additional pay. So we're telling employers and we're highly encouraging them to provide sick leave benefits, medical insurance coverage, additional medical insurance coverage, because like I said, bills from COVID can run up to the millions, including supplemental pay allowance. And this is where we're talking of those quarantine leaves for employees who test positive for COVID or for close contacts who have undergone a 14-day quarantine. Okay, clarificatory advisory number 2 talks of shuttle services, which now has been overtaken by clarificatory advisory number 3. So just to give you the history, we in the second this advisory we said that for large companies with 100 million assets and above in special economic zones, you are required to provide shuttle services. But because we also understand, and employers did talk to both the DTI and DOLE saying it is very hard for them. It's now really difficult times, and they may not be able to sustain the provision of these shuttle services. Then they can contract the service, then they can be cost sharing. And you can also contract the services of other public utility vehicles to assist you. That is the history, because this has changed. Now, in shuttle services, I already mentioned there are still important rules to be followed, and this is carried on to the advisory number 3. In all of these shuttle services, there should be the use of face mask, face shield, no talking, no eating, no answering of phone calls. You can text, but no calls. So again, if you understand the rationale of all of this, it is to limit secretions, so that because you're in enclosed space, we do not like that if anybody there who may be positive for COVID would have their secretions out, and then it would then be, in an enclosed space, affecting the workers who are present in that space. This portion of the clarificatory advisory still stands, and it now is what should be done. So the most at risk and workers below 21 years, they can report physically for work, as long as there is a fit to work examination and there is a medical certificate from a competent authority, meaning an occupational health physician. And we know that not all companies may have an occupational health physician. Then they can go to a government physician with occupational health training certifying that they can do work for 8 hours. But of course, we still really encourage that employers, if they can provide work from home arrangements for these workers, then that is really the best arrangement for these kinds of workers. Isolation areas, these are in this clarificatory, it is what is, this is the existing requirement, meaning look at one isolation per 200 employees, and these 200 employees you only consider those who are physically present in a shift. We're not looking at the total number of employees in a workplace, but those who are reporting to work per shift. Like even if you have 1,000 total employees, but 500 would be reporting, you would need at the least 2 isolation areas. But what is needed would be the second bullet, the temporary holding facility, especially if you have employees or visitors who, in the temperature check, which is also required, they would register a temperature above 37.5, or they may have symptoms of cough and colds, and you will not allow them to enter unless they are first checked again. And they, of course, after they're assessed, either they're told that they can continue to enter because maybe their colds would be an allergic type, or the increase in temperature may just be because they're out in the sun for a while. Then they will be, otherwise, if it is because of an illness, then they should not be entering the workplace, the premise, and they should be going home. Now, on that isolation area, which is now meant for workers who, either were swabbed and could not go home because they have no proper quarantine facility in their home, then we're saying companies, please have them naman for your workers, or let there be an arrangement with with the barangay or the LGU, so that you can put your workers there. Those who are, suspect, or those who have tested, especially those who have tested positive, because our omnibus rules now say that all positives should be in a temporary treatment and monitoring facility, so that they are properly observed and they're out from their families where, a possible transmission can happen. On closure and disinfection, this is the new closure and disinfection guidelines. We are saying that company policies on temporary closure should be present, so that with that temporary closure, you can also do extensive contact tracing, and you can also pinpoint areas for that disinfection. And in the policy there, because you're allowing other areas to continue work, then it is also important that you guard, those people who continue to work from those areas where disinfection will happen. And we also say that all companies, all workplaces should have regular disinfection procedures. So granular lockdown is already accepted, meaning to say only areas, you do not have to close down the whole building, only areas where there was a positive case or in where cases were found. And we also said that this is a shorter lockdown of less than 24 hours, meaning 3 to 4 hours will be allowed, as long as you, in your policy, you have made sure that those who are allowed to work, their safety is provided, and that those who now return back to work after 3 or 4 hours, ascertain then or ensure then yung safety nila when they go back to that area that has been extensively disinfected. In this advisory, it also provided for the air conditioning temperature, especially in malls, so that they can really decrease it to a more comfortable temperature. So this was the previous one. So this is not anymore the disinfection procedure after I've issued the clarificatory advisory number 2. So let me just end here, but do not, because I will go to the latest clarificatory advisory number 3, which is here. This is the latest. This was issued, if I'm not mistaken, December 1, or it was published in December 1. And this is where now we are addressing the requirements, or that we can now, increase the capacity in shuttle services, and what our contact tracing information should now have, only those that are important. And yes, basically these are the important items in the third clarificatory advisory. So, okay. Yeah, as we mentioned in the second clarificatory, we said it is required for companies with assets of more than 100 million. It is now modified, saying that establishments are enjoined to commission their own shuttle services. Many lawyers would argue that enjoin means mandatory. Here, we just say it's no longer mandatory. That's why we have modified it. We highly recommend, we highly encourage, but it is not anymore mandated. And we also, because of an issuance of the LTFRB, which allowed that private utility vehicles can do or may follow a one-seat apart arrangement or a full seating capacity, provided that necessary dividers are in place. Companies who had shuttle services requested the DTI and DOLE to adopt this. And this was, again, of course, approved by the IATF. And that is why for shuttle services, we now can say that, yes, you can do full seating capacity as long as the dividers are there, because we got this from the basis of the LTFRB. But please, when it was also discussed by in the interagency, we also saw that, for shuttle services, there's a health declaration. There is really, the need. That's why it's very strict that monitoring of those who ride shuttle services and ensuring that they should comply with the no talking, no eating requirements are there, and the ventilation, because these are still governed by workplace policies. So there is really, kumbaga, it's even better monitored in shuttle services than in public utility vehicles. For contact tracing, we are saying that because of information that is really very confidential, the required information in contact tracing form shall be limited to the name and contact number of the customers, clients, examiners, and visitors. There's no more need to ask or to ask about the symptoms, exposure, that whole declaration form. If you're an employee of a workplace, then please fill it up. That is requirement. But if you're just a visitor or a client, then you just need your name of the temperature check, which is also of course required, and your contact details. But again, we always tell companies, make sure that this information is secure because it is guarded by a Privacy Act and is confidential. On digital contact tracing application, we it is already a resolution in the IATF that we shall use the Stay Safe application for contact tracing. That will be the official digital tracing application, and this is integrated actually with the DOH CDRS, their COVID-19 documentary repository system. So that gives you a complete database of information of cases and of those who are contact traced, and of course to assist also in contact tracing. So that is it. That is up to the latest clarificatory advisory, and that is that the newest one was just a few days ago. Again, thank you for inviting the DOLE for this webinar. If you have any questions, please feel free to ask.
Thank you very much, Secretary, no, for that very informative discussion about these guidelines. By the way, Doc, we selected 10 attendees to be to ask you a questions.
Ganon? Sige.
Yes, Doc.
Kaibigan ba yan?
Yeah, Doc.
I hope they're friends.
Ayan. First, si in our list, be ready, Ma'am Angelique Di Sosa. No? Okay.
I'll stop share, Can I stop share na po?
Yes, Doc. Yes, Doc.
Okay.
Okay, Ma'am Angelique, you may now ask your question.
May question dito, if I can share my slides, please do so. I'll let our secretariat share you all the slides that I presented.
Okay, sige, Doc. Thank you, Doc. Okay, I think sige, si Sir George Luis. Okay, allow kita, Sir George, para you may ask your question live. Ayan.
No, sa chat room, can I just read na lang?
Sige, Doc. Sige, Doc. Yes, Doc.
Kasi,
yes, Doc. Sure, Doc.
Oo.
Kasi may ano ka pa.
Nandito si Angelique na.
Okay, sige, Doc.
Ang dami kasi, I'm now looking at chat and the question and answer. Ano bang unahin ko?
Okay, Doc. Ito na lang, Doc. Regarding dun sa first question, dito na lang tayo muna, Doc, sa ano. Regarding kay ito, Doc, if negative na po yung nag-positive sa virus, kailangan pa po ba mag 14 days quarantine before siya bumalik sa work? Or pwede na po siya mag back to work once he tested negative?
Oh, ganito ang bago Pero sabi siya, nag-e-evolve lahat ito. Pati kami nabibigla At magdi-disclaimer kaagad ako. Anong latest ng DOH, if you're a confirmed case, mild or asymptomatic or mild, 10 days, you're fine. But have your, dapat magpa-clear ka lang. Pero ang sinasabi ng DOH, your infectiousness at 10 days that's it. Kasi I had to ask, ka-quarantine pa ho ba yan? And I'm really being very frank and candid because I just wanted to make sure because that was the first issuance. They said no more because infectiousness, wala na in 10 days But you still need to be medically cleared kasi if you still have some symptoms and the medical personnel just wants you to still get the clearance, then you have to follow them. But really, you do not even, if you want it, but if you test negative like on day 8, sinasabi nila day 10.
Yun, thank you, Doc. Ayan, Doc, I think itong question about ni George Luis, ito yung the general application of these guidelines into construction site.
Iba. Okay. Let me also thank you for that question because this is kasi I saw for warehouse all establishments except for ito na yung mga exception kasi when the IATF gave us instructions to do the guidelines for industry, DOLE DTI, for construction, DPWH, for restaurants and hotels, there's the DOT and DTI. So but what we're saying is, dan sinasabi naman sa amin ng DTI for the restaurants, sa inyo pa rin, kasi pareho naman kami ng DTI gumawa ng joint, but then medyo, kasi restaurant lang naman, but they also had to ensure the public safety kasi nga may kumakain doon. So they added a little bit more on that aspect, but it's still actually our JMC for if you're talking of their workplace and their workplace. But construction, it's DPWH. The latest is DO 39. I think they also call it DO 39. But I heard from them, they're also revising this already. So just watch out na lang. Go always regularly check in their website if they will issue now another guidelines on COVID-19.
Yun, thank you very much, Doc. No? Doc, do you have idea about the PhilHealth reimbursable quarterly tests regarding the process?
Ganito daw yan, as long as an accredited PhilHealth laboratory, and maybe you could also ask PhilHealth their requirements so that they can be reimbursed. Reimbursement to So it's out of pocket first, but that you can be reimbursed as long as it's an accredited PhilHealth laboratory and get the other requirements from PhilHealth so that you can be properly reimbursed. But it is reimbursable.
Yan. Thank you very much, Doc. Itong isang question, Doc, in hospital setting employees who are also required to have health checklist form and for visitors form as well. Is the triage area for visitors sufficient for visitors and patients of the hospital? So it is more of the checklist form, Doc, compliance.
Ano yan? Binasa mo sa chat?
Yeah, yes, Doc. Yes, Doc.
Kasi ito. Okay, I got it. In a hospital setting, employees are also required to have. Yes, of course. Kasi employees are kasama yun sa health declaration form. Visitors, you just might need to ask what is required. Kasi, but if the hospital, kasi iba na ang hospital setting, I would like to also give the hospital so that even because if you already have symptoms and you're also entering a hospital, they might need to get, more information. We leave that up to the hospital. But if it's just really going to like malls or restaurants, then you really do not need to have further questions. But so if they will use the health declaration, and it's a triage, I think wala na yung question. Ano yung nasa triage? Anong tinanong doon, Neil?
The same, Doc. Yung pag-comply nila with the checklist form. The health
we leave that also up to the hospital. If yan.
Okay, Doc.
Yun.
3 more questions, Doc. Kasi I know.
Marami nga eh. Can I just go through them na lang quickly because in a little while I have to leave.
Yes, Doc.
Okay.
Yes, Doc.
Okay. Who can have their test quarterly? Should be asymptomatic at any time. I do not wait for quarterly, please, for symptomatic. If you're symptomatic with COVID, do not wait for 3 months. Please have yourself tested. But if you're starting to have symptoms, always remember you may test negative in the beginning, and that's what they're saying. Give them like 3 or 5 days, 3, 4, 5 days when the symptoms so that when you test, that is really the true test result already. Because early, if you're just starting symptoms, you might still test negative. Okay. Um, Currently, employees are currently working from home. In case they fail to report to work virtually for 3 days, can the employer send the return to work order despite working from home? It's up to you. What is your policy? What did you agree upon? We have a telecommuting law. If you use that law in determining your work from home arrangement, it requires that you have an agreement. So if in your agreement and your policy is that you can you ask them to be physically present already, then you can do so. Actually, the telecommuting law is just an agreement, and it can, of course, upon the need of the company, you can suspend the work from home arrangement. An employee who works as a driver got infected when he was asked to drive the company emergency vehicle to bring the wife of a co-worker to the hospital. Co-workers have also tested positive. Can he file for EC? Since he contacted, yes, that he can file for EC benefits. And yes, the EC benefits as well as the GSIS benefits, maganda naman din po. Okay. Ma'am Tess, paano po pag nag-negative yung close contact? Pwede na ba siya pumasok sa work? Hindi nga eh. Alam mo, doon nga kami nag-ano kasi kung close contact ka, 14 days talaga. That is really, and up to now, we always, kasi we constantly also dialogue with the DOH, it's still 14 days for close contacts. Okay, LGUs are requiring private companies to submit health certification of all employees for issuance of sanitary permits. Dati business. Most frequently, companies use their annual physical examination results for this purpose. But on-site APs are being discouraged right now to minimize employees going out of home. Can DOLE mediate on allowing leniency of or allow submission of chest x-ray? Alam nyo, we were asked on waiver of the annual physical. We cannot waive. If you cannot do it in the company, have health service providers use your but kasi that annual physical examination is part of the standards, and it is not just an issuance of the secretary that will remove this. And that is why it is important that we have to comply. If you cannot go to hospitals because they're scared of hospitals, if you have, marami naman nagla-laboratory at home, have all of this mechanisms or strategies so that you can do the APE. On X-ray, they may not be hospital-based X-ray as long as they can schedule naman their time. Mauna sila sa umaga, mga high precision, may chest X-ray na rin yan eh. Mauna sila kung natatakot para mauna sila at na-disinfect naman. At least you avoid the hospital setting that everybody is so scared of. Or if you're not naman, they can go to the companies, the health provider is there as long as accredited, then they can do the health examination check. But it's not where the APE has to be done. Okay. LG, ito. Tapos, employees working from home contracted the virus. Shall employer still shoulder? Kasi work from home siya. Shall the employer still shoulder the cost of testing? Paano ba siya nahawa? Kasi, sige, nahawa nga siya. Ngayon, nasa niya yan? Kung may CBA kayo, kung may policy kayo, why not? But, pag-usapan nyo na lang po. Hirap ako
Actually, Doc, that's the problem right now is itong work from home. No? What if kung ikaw ay nagkaroon
COVID. If, but kasi nga, work from home but PhilHealth will still, ganito. Nga pala, thank you for reminding me. If you are symptomatic, and you are a PhilHealth contributor, sagutin niya ng PhilHealth. Sagutin mo yan ng PhilHealth. So, hindi na employer. PhilHealth ho yan. But I don't know kung reimbursable sa'yo, you will reimburse it through your company, or you don't need to pay as long as you provide. Kasi yung test ko agad-agad yung, hindi naman sagot namin yun. So, I cannot answer you on my But then, I know PhilHealth will provide because that is part, especially because you are symptomatic. PhilHealth,
Doc,
kuya.
last question, Doc, from ano, I
Sige.
know that you have that activity pa. Doc, yung regarding lang dito sa ano, we have this sa YouTube na question. Required pa rin ba yung health clearance certificate when they go back to work?
Oo, sa barangay,
Yes.
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 Yes, it is a requirement. Pasensya na, it's a requirement by the DOH and the LGU. We ano ang mag-override sa amin will be the DOH eh. Kasi this is a health we are in a health crisis and the DOH is also our lead agency here.
Okay, thank you very much, Doc, for your time.
Okay na?
Before ka, Doc, mag-out, ano, we would like to read this certificate of appreciation. The National Occupational Safety and Health Coordinating Council of the Philippines. Certificate of appreciation is presented to Maria Teresita Esco Cueco, Assistant Secretary and the concurrent Bureau of Working Condition Director of the Department of Labor and Employment, for sharing her invaluable time and expertise as guest speaker of the NOSHCOP's webinar on control and management of COVID-19 in the workplace. Thank you very much, Doc.
Thank you, Neil. You
Thank
know,
you.
to all your participants, please send the questions to us. Our email, bwcsecretary@gmail.com, or go to our website. We already have question and answers on COVID. If your question is there, you already have the answer, fine. If it is not, please email us. We will get back to you. We are answering all those queries, and just post them, we will answer them po. So feel free, Neil, you know our email
Yes.
naman,
Yes, Doc.
gather these questions, we will answer them po.
Okay, thank you very much, Doc. No?
Thank you din, Neil. Hope to see you when this is
Yeah,
over. These are
yeah, soon.
challenging times, but this brings out the best in all of us.
Yeah,
And
Doc.
as we have
Thank
to
you
go
very
through
much,
all
Doc.
of this. Stay safe.
Take a rest then, Doc. Take a rest.
Thank you, kayo lahat. Stay safe po lahat. Thank you so much.
Thank you, Doc. Thank you. Okay, so to all our attendees,
I will leave na ha.
yes, Doc. Thank you. Okay, to all our attendees, you may send your requests to the noshcop.education@gmail.com for your certificate of attendance. And we will be sending you as well the copy of the presentation from Assistant Secretary Cocueco. Okay? And I would like to take this opportunity as well to invite you for the next webinar. It is a free registration webinar on December 10. Our guest speaker, no other than Executive Director Engineer Noel Binag, to discuss the accreditation requirements and procedures for the occupational safety and health practitioner and consultant, but especially during this time of pandemic. Okay, so we will be sending invitation soon with regard to that webinar. So thank you very much and have a great day, everyone. Thank you for attending this webinar, and we hope that you learn a lot from this webinar. Magandang hapon po sa lahat.